folks that are joining in. We have a very special show today. I'm very excited to have Dr. James Anthony, who is graciously making himself available to do a part 2 in Q&A about feline stomatitis, a subject that sadly is very dear to a lot of people's hearts, struggling with their cats. And we're very thankful for a lot of great questions that were provided from the folks ahead of this event. So we're going to do our very, very best to have Dr. Anthony answer a lot of your questions. And full disclosure, Dr. Anthony is Elite Science 1 TDC Chief Medical Officer. He might mention the product from time to time, but the focus here is to focus on answering your questions. If you're live and you're watching us, if you have some questions that are beyond what is going to be talked about, we will do our very best to answer those questions as well. Before I bring Dr. Anthony, a little bit background on Dr. Anthony. He's been a veterinary dentist for over 30 years. He has a passion he's done tremendous amount of clinical work, research. He has a passion for teaching to veterinarians across the world. He's established many protocols in different countries, and we're absolutely honored to have him join us today. And if you want a copy of the transcript or the blog that's going to come from this live show, you'll see down below, if you type in the notes, stomatitis, that will put you in so that we can send that to you. And of course, 1 TDC, which is our product that helps a lot of cats, we're going to have a lucky winner also that will be selected for that. All right, so we're very excited to have Dr. Anthony. I'm going to bring him on board right now. There we go. Dr. Anthony, thank you for joining us.
You're very welcome. Good afternoon, Olivier.
Good afternoon. Again, thank you for doing this part 2 on Q&A for stomatitis. And I think we're going to go right into it. We have a lot of great questions that were submitted, so we're excited to get going. Let me show the first question to the group.
Sure.
And let me read it out for us. And as my phone is ringing, so let me turn that off. My cat's biopsy results showed reactive changes with lymphoplasmacytic and neutrophilic inflammation. He doesn't show any pain. He only has red gums, one side. He's 2 years old, and I use toothpaste and liquid to clean his teeth. And that's actually a longer question. Let me just finish the second part. The vet told me to wait before removing any teeth because he doesn't show any pain. And the person is asking, I don't know what to do. So Dr. Anthony, a case like this, what would be a good advice to help this pet owner?
Well, the first thing is, what clarification did he use or to evaluate whether this animal has lymphocytic plasmacytic stomatitis, because that is a histological diagnosis, meaning you got to take a biopsy of the tissues in order to determine that. So you can say it looks like that, and we're going to do some home care for a month, maybe 2 months, and see how it goes. And if there's great improvement, then we know it's not the lymphocytic plasmacytic stomatitis, but rather periodontal disease. And it's resolving. But if it continues to be the same and progress, or the cat is further in pain, it means that there is more advanced disease, which could be lymphocytic plasmacytic stomatitis, but more often than not can be actually periodontal disease. And so if the animal's showing discomfort with brushing, for example, then you should get some action done. Basically, the cat is in some discomfort and there's some disease process going there that needs to be addressed. Simple as that.
Thank you, Dr. Anthony, for your thorough answer. And I think if you've just joined us, thank you for joining. You're watching a live show with Dr. James Anthony, boarded veterinary dentist, and he's answering some questions in Q&A around stomatitis specifically. Of course, his answers, just and be patient, will be general. He cannot give very specifics to a case unless he has a full medical history. So this is general questions based on these 30 plus years of being a veterinary dentist. Let me show the second question. What would cause stomatitis to be present years after all the teeth have been removed?
Okay. Well, that's a very good question. and the most common one is actually retained roots that have been broken off and left in the mouth. A lot of times it's because x-rays weren't taken, or post-operative x-rays weren't taken after they've extracted. But also what can happen, even if you get all the roots, sometimes you could have inflamed bone. So what we call woven bone. And as a result, basically that can cause an irritation, a chronic irritation. And until that's actually removed surgically, it could still happen. So you would see an improvement with that treatment. However, it may not be basically curative or basically resolved. And in most cases, there will always be a little bit of inflammation if the animal's stressed or in a stressful situation, because basically their immune system is compromised, and as a result can't fight off the inflammatory response that is created by the bacteria.
Excellent. Thank you, Dr. Anthony, for that. And thank you again for the person that submitted the question. Again, if you just joined us, we're live with Dr. James Anthony, board veterinary dentist. We're going through the questions that were submitted ahead of time. We're keeping an eye also on comments in case somebody else has a live question that you want to add. Let's go with the next question. Is stem cell therapy option viable for treatment of stomatitis? My cat is due to have a partial mouth extraction soon. I'm wondering if it would be better to wait for this non-invasive treatment.
I mean, this is a great question because this is current research that is going on right now. Stem cell treatment, it has the potential of being very, very good. However, it's too early in the stages to say that it's helpful or not. It is really just in the infancy, so it's not going to be for another 3 to 5 years before we even have any answers to this. I mean, I would like to think that it would be beneficial. I've used stem cells I've seen it being used for other purposes, and it works wonderful. And I hope that it does work for stomatitis and some other cases. I know a few colleagues have used this and have had some mixed results. And as a result, it is an option, but right now it's too premature for this. This is what we call host modulation therapy, and there's a whole slew of different host modulation therapies that are being researched right now on inflammation in both dogs and cats, and for periodontal disease and lymphocytic plasmacytic stomatitis as well. So there's a lot of things in the works, but they haven't been confirmed, and also they haven't. Some of them are just products are just too expensive as well, and they may have a lot of side effects. Stem cells does not seem to have the side effects, which is good, but it is not cheap either.
Yeah, thank you for that, Dr. Anthony. Let's go with the next question. I brush my cat's teeth every day. What else can I do to maintain my cat's dental hygiene? And I guess that's a question both for gingivitis, stomatitis, or any cat for that matter.
Absolutely. You know, the one thing is to get the animal treated properly first and get to a good, healthy mouth, basically, or as healthy as it ever will get. Simple as that. So usually that means it's about 10 days to 14 days post-surgery. So if you've cleaned up the mouth, done some root planing or extracted some teeth, 2 weeks later, that's when you really have to start with a real thorough home care plan. Now, what does that entail? Well, the first thing is every animal is different. Not every animal is going to accept brushing. Not every animal is going to accept different products. And then second of all, the owners. Not every owner is going to be able to do brushing. Not every owner is willing to do other things, or do things twice a day or something like that. So it varies between basically what the owner can do and what the animal will let the owner do. So to give you a general idea, brushing is great. I think it's wonderful, and if people can brush, I would thoroughly encourage them. However, the sad news is about 3 to 5% actually truly brush. So not very many, or they brush effectively. I mean, I've had people say, yes, I brush once a month. Well, that does nothing. You have to brush every single day to be effective. So, once a week, twice a week, 3 times a week, you might as well not do anything. So brushing every day would be fantastic, but there's lots of things one can do even without brushing. For example, does that everybody like giving treats to their pets? Absolutely. One thing that you could do is get basically a feline dental diet and use it as a treat, not as a diet, but as a treat. Say about 10 kibbles a day, just give it as a treat. And the cats love it. And what it does is that by chewing, it just naturally removes the plaque and calculus from the teeth itself and tones up the gums as well. Then there's other things. 1-TDC, fantastic product for controlling inflammation in the mouth, decreasing all that redness that's there. Basically, it takes about 2 weeks to be as effective as it ever will be, and works very, very well for keeping and preventing the gums from getting worse. Other products, chlorhexidine-based products. Again, most of these are oral, but TDC, you can put it in the pit of the ear, the inside of the ear, and leave it on for 10 minutes, then wipe it off. And some of the other products, like chlorhexidine, most of them have to be given orally. And as a result, you may get a couple drops in there, which is all that's needed. And doing that once a day. Another product is zinc ascorbic acid, MaxiGuard. Great product, and it's great for the gums, and it does have a slight antibacterial action as well. There's other products and drugs and whatnot, but usually those are referred to for in situations where it's a much more advanced procedure or case. But those simple things that I've just mentioned are very easy to do and very acceptable to most dogs and cats, for that matter, and can be very easily acceptable for both the owner and the pet. There's other things like water additives. One is called, I just forgot the name.
Healthy Mouth?
Pardon me?
Healthy Mouth is one of them.
Healthy Mouth. I mean, it's a great product. It's an organic, basically it's a natural product that you add a little bit of this, like a capful to a liter of water, a quart of water, and use that as a drinking water. And it helps decrease plaque and calculus. Though all those things help in different ways, and we're having a multimodal approach to control of inflammation and plaque and calculus. You got to remember, plaque and calculus has the bacteria, and that's good to get rid of that, but also controlling inflammation is the key to preventing the destruction of the tissues. Okay.
Good. No, thank you for the thorough answer on this one. And while this particular cat owner is able to brush the teeth every day, as stated, to your point, that's not a usual situation. That's an unusual situation. Let's talk about the next question. What are your thoughts on cyclosporine, or also known as Atopica?
Well, cyclosporine is a great product when needed. Not every case needs it. And for stomatitis in cats, it's a nice product to have when the basic stuff doesn't work. I always like to take the approach as being a minimalist. So try the basic stuff first, because most times, probably about 70% of the time, that's all you need. But if you need something more, then Cyclosporine or Atopica, or there's other names to different products, is a great alternative to help along with those basic products as well. The basic products are the ones that I just mentioned for home care. So they can all be helpful. The dental diet may not be acceptable initially because the animals are in discomfort and pain, and as a result, you'll have to wait until that is under control before you can use a dental diet. But Atopica, unfortunately, is not cheap. And second of all, it needs to be evaluated every month with the blood test or white blood cell count because it can affect so it does have some side effects. And as a result, basically, you have to get the monitoring done. Otherwise, you are risking the animal's life. So it's a very safe product if used effectively and safely and monitored.
Monitoring with your veterinarian, and maybe just if someone just joined in, so your initial, as a minimalist initial approach, obviously every case is different. What are if you can recap some of the key products, or just so that the pet owners can remember that in case they just joined in.
Well, if the cat will allow brushing, great. Usually with stomatitis, it's so painful that they won't allow it.
Yeah.
So you want to basically use 1 TDC to decrease inflammation. And a lot of times they're even sore to put anything on the lips or inside the mouth. So you may end up having to apply it in the ear and then wiping it off after 10 minutes. Basically, within 5 minutes, 95% of the active ingredient is absorbed and circulated through the whole body. Other products, chlorhexidine, great product for decreasing bacteria, so controlling plaque. And then MaxiGuard is another good one. And once the animal is actually pain-free or decreased in discomfort, using basically a dental diet to help keep the mouth clean, it would be other things to be considered. And another product that would be very good is the Healthy Mouth water additive product. That's easy to do, easy to be accepted. The only problem sometimes is some cats are very, very finicky in the sense that they don't like anything different. And as a result, they see a slight discoloration of the water. They say, no, I'm not taking that. So you do have to keep a watch of them for that.
Yeah, thank you for the recap. Let's go into the next question, which is a bit of an extension of the earlier question. What do you think about cyclosporine and prednisone combined together?
Well, in all fairness, I very rarely use steroids, such as prednisone, dexamethasone, or any of those types of steroids. I can count, on both hands the number of times I've used it in my career. So it's something that I do not use a lot. It's very rare that I have used it. And I find that by using steroids, now we're not talking about NSAIDs, non-steroidal anti-inflammatories, but steroids. If we use steroids, pure steroids, I find that those cases end up and have a tendency to end up being refractory cases that are very, very difficult to treat. So I try to avoid steroids if I can. So I'm probably not the best person to talk to about combination therapies with steroids because I don't use them very often, very, very little. So my advice is not to use very much because they can cause more harm than good, I feel.
Okay, that's a really important point because a lot of people wrestle with that and often are advised. So in that case, I assume, if possible, refer to a veterinary dentist, which is not always easy to access.
Well, I feel that most veterinarians will appreciate this. What I'm saying is just that steroids are a quick fix. It's a quick fix. It gives a temporary solution to a long-term problem. And, you can't give it every single month like a Depo-Medrol injection, which is a long-acting steroid. Those cases, there's too many side effects long-term. So as a result, steroids have to be used with caution. I'm not saying that they can't be used safely. I'm just saying that you have to use a lot of caution, and I would prefer to use other things that I find far more successful. Simple as that.
Yeah, thank you for that, Dr. Anthony. If you just joined us, we are live with Dr. James Anthony, a boarded veterinary dentist, over 30 years of experience, and we're very fortunate that he's answering some submitted questions that you guys sent to us. Of course, if you have any other questions, perhaps that have not been covered, that you are burning to ask, just put a notes in the comments, and we'll do our very best to cover those. And also, if you want to get a copy of this video or transcript, just put stomatitis in the notes, and it'll take you so that we can capture your info to send that to you. All right, let's go to the next question here. Senior cats or cats with chronic kidney disease, diabetes, or heart murmurs, how worried should we be about these cats going under anesthesia? What steps can be taken by a general vet to protect them from their, potential partial or full mouth extraction? How do we deal with that? That's a really tough question.
Well, the first thing is, should you be afraid to put them under an anesthetic? Absolutely. There's no such thing as a safe anesthetic. They're all complicated, all calculated poisons. But they're safe anesthesiologists. And that's people that do good workups on the animal. So in other words, they know what their blood work is like, what their kidneys are like, what their liver's like. So they are prepared. They're prepared for surgery. They listen to the heart. They may take a chest x-ray or an ultrasound of the heart just to make sure that they are fully aware of all the potential complications that are there. As far as an animal having advanced kidney disease or that, I mean, they can be put under safely. However, you've got to have them extremely well monitored. And I prefer to have basically a board certified anesthesiologist help me with those cases. In fact, with most cases, I find that by me concentrating on what I do, dentistry, and let them concentrate on the anesthetic, I'm far faster at doing my procedure. So my procedure is cheaper, but you have to pay for an anesthesiologist. So the balance is that it comes out to be the same price. So if I had a choice, I would always have a anesthesiologist doing the anesthesia alone. However, not everybody has the luxury of having an anesthesiologist there. And there's a lot of veterinarians that are very, very talented at anesthesia and careful and successful. So just because you don't have one doesn't mean that they're not safe, okay? But the big thing is the workup before the general anesthetic. In other words, full physical exam, blood work, and a full panel blood work, which means checking the liver, the kidney, the pancreas, all those organs. And then listening to the heart, lungs, making sure that their blood pressures are fine. All these things are important prior to the procedure. And if there's question marks there, they need to be investigated first and dealt with, because you can make basically an animal much healthier and safer to go under an anesthetic by doing that.
Excellent. So calculated poisons administered by an expert, I think, is the conclusion, and don't compromise there. Excellent. We have a question also that's live from Rudy Clark. So let me read that for you if you can see it, Dr. Anthony. How long should an older cat remain on Atopica? Thanks, Rudy, for the question.
Well, what I always try to do with Atopica is once I have control, then what I'll try to do is decrease the dose to where basically if I decrease it anymore, the lesions are coming back. And and also using other products that are the maintenance products that we talked about earlier to basically try to minimize the amount of Atopica that is needed. One, to reduce costs, but also, and more importantly, is healthier for the patient. I mean, you never want any animal on drugs. Simple as that. I don't want to put them on drugs, but unfortunately with this disease condition, unfortunately drugs are necessary most times. And so the best answer to that question is the shorter the better. But I know animals that have been on it for 5-6 years. So, basically it's maybe once every 3 months for, so as a result, it can be minimized. Instead of being every month, it could be once every 3 months or even more. So it varies between patients. And is it safe to be long-term? As long as you do the monitoring, yes.
Excellent. Yeah, thank you for the question. That's a great question. So work with your veterinarians and see how much you can wean off for. Make sure that you're doing the right thing for your pet. Let's go to the next question. Many cats are misdiagnosed with stomatitis when it's really juvenile gingivitis. How can you tell the difference, and what treatment plan or home care should you do?
Okay. Well, first of all, juvenile stomatitis is in young cats, and that means cats that are less than 2 years of age. Anything older than that is not juvenile, gingivitis or stomatitis. It also means that there's inflammation on all the gingiva all around the teeth, everywhere. And usually it's an indication that it has an immature immune system and is susceptible to periodontal disease. And as a result, once that immune system is basically fully developed, it can actually self-cure. However, with those minimal amount of home care products that I mentioned earlier, I've seen many cats with juvenile stomatitis or gingivitis actually, after a month, be cured and no further treatment. Now, if things do not cure and it's still as bad as it is on presentation, the first presentation, that's when you are probably dealing with a stomatitis situation and will need more advanced procedures and treatments, unfortunately. But ultimately, those conditions really are also histological diagnoses, so where you take a biopsy of that tissue and send it off to a laboratory for diagnosis.
Excellent. So still the same approach, minimal approach, good home care, and then follow up with your veterinarian. Excellent. Thank you for that, Dr. Anthony. If you just joined us, we are live with Dr. James Anthony, boarded veterinary dentist. If you want a copy of the transcripts and the video, just put in the comments stomatitis and we'll help you with that. And by the way, he did mention one TDC, our product, that we provide to veterinarians for promoting healthy inflammatory responses. We're going to give a bottle away to one of the lucky winners. Let's see what we have next here. We have another good question for you. Let's see. I don't think we did that one yet.
No, we did that question.
We did that one. Let's go right into this one. Okay. And this is an interesting question. If you do not have access to a veterinary dentist, nor a veterinarian who has a dental x-ray unit, what steps should they take?
So we're talking about steps they should take for full mouth extraction in cats. Is that correct?
Well, I think it's more in the sense of, extractions or what step, you're going to be in a position, you don't have a dentist. It appears you have stomatitis. It's been diagnosed, but you're also dealing with a veterinarian that perhaps does not have a dental x-ray machine. That's a tough situation. What should be done, and perhaps what should not be done?
Well, first of all, if it's extractions that are needed, and you only know that whether it's needed or not is via x-rays normally. I mean, unless there's reabsorption of the roots or that, but then you still need x-rays to see if there's any retained roots in there, because otherwise you still have the problem afterwards. Whenever you're doing an extraction, one needs to take x-rays before and after. To put it very mildly, a lot of people say, well, I can't afford an x-ray or they don't have access to one. That's fair enough, but then really you're compromising the treatment of that patient. It's like a dog with a broken arm, forearm or leg, and you're doing a repair on it, and you don't have an x-ray of that break. Well, that's considered negligence. Here, you don't know what you're doing in the mouth without an x-ray. Personally, I feel that's negligence. That's me. I know that the rules aren't all the same, but I feel that you cannot do a proper job if you do not have an x-ray. I mean, sometimes it's a balancing act in let's say a third world country where maybe they don't have access to it, but they should always offer basically a procedure to an advanced veterinarian that has these facilities and products such as a dental x-ray machine. So they should offer that as a referral, or say that, if you want me to do it, I want you to realize that there's a compromise, and we can't do it as good as that individual because we don't have those products. And, it would be more like a last resort. I mean, to give you an idea, as far as, let's say, people traveling to get things done, basically, I've had clients where I used to work in Red Bank in New Jersey, and the furthest client that ever came to me flew from the Philippines to New York, basically. So, I mean, that's a long way to travel just to get their dog treated. And as a result, there are people that will do that. They're few and far between, in all honesty, as you can well recognize. However, that option always should be given. And people need to be aware of what they're getting as far as treatment and be prepared for basically the negative aspects of not having that equipment available.
Understood. Yeah, that's a tough one. Obviously, not everyone has that luxury to fly for treatments. So basically, if I recap what you're saying is dental x-ray should not be something to be negotiated upon from proper treatment. In a desperation, if a step is taken and there's no dental x-ray or any form of extraction or cleaning, or whichever steps the veterinarian decides, to understand that there's a risk associated with the fact that you're not able to see the roots of whatever thing is extracted. Yeah, those are tough situations. If you've just joined us, we're live with Dr. James Anthony, a veterinary dentist with over 30 years of clinical experience and done a lot of research. And if you just joined as well, make sure that you put stomatitis in the comments. You'll get access to the whole video and notes from this event. And Hootie Clark, you had a question about One TDC. That's the product that Dr. Anthony, actually with our company, has researched tremendously and used with over 20,000 patients, probably even more by now. But it promotes healthy inflammatory responses. It's very easy to use. We'll put a link so you can have access to all that information, so we can keep going with some of the other questions we have here. All right, next question we have for Dr. Anthony. This is a pretty long question, so let me read that one off completely. We recently adopted a cat, and she has Gingivitis stomatitis. The rescue have aged her approximately 2 years old. She's FIV and FELV negative. She's seen both the rescue's vet and their own. Rescue vet says it's quite mild. Our vet is inclined to believe it's gingival stomatitis, but says she has seen much worse cases. She had a full-scale polish during her spay, and the rescue vet says we want to wait to see if there's any improvement. What steps should be taken to fully diagnose her? Is it a possibility that it's not gingival stomatitis? Should we be considering juvenile gingivitis? Testing for portabella, feeling overwhelmed and not sure what to do next?
Well, there's more than one question there, so we'll try to answer one at a time. The first thing is I would never recommend doing a sterile surgical procedure with a filthy dental procedure, because you're releasing bacteria throughout the whole body in the blood, and it can lodge into the areas of your sterile surgery site and cause complications. If they do, they need to cover the animal with antibiotics during the surgery and post-operatively. Okay, so that's the first thing. Second thing is basically when they're under, if they want to find out if it's stomatitis, do a biopsy, because that will be a definitive statement as to what the diagnosis is. Okay. The second is that afterwards, you got to basically get the mouth cleaned. So you clean up the mouth, which sounds like they did, and then put them on some home care products. After the home care products have been utilized for about a month, you should have that animal back to your veterinarian for a reevaluation. If it's periodontal disease, basically it's going to be almost completely cured. If it's stomatitis, basically it's not going to be cured. It could be aided, but if it's juvenile gingivitis or stomatitis or gingivitis, it will be greatly improved with that, if not eliminated. So if you don't have lesions, maybe it was that. However, the big thing is doing the home care and then following up with your veterinarian and finding out how things have been after a month, and then either continue with home care or you might have to do some more advanced procedures.
And if you've just joined earlier in the video in the live, Dr. Anthony a couple times covered his minimalist, I would say, approach to home care that everyone should be considering. So if you haven't heard that, just make sure you put stomatitis in the notes. That will get you access to the full video going forward. Dr. Anthony, let's go to the next question. Let me read that one out completely as well. My cat is scheduled for a possible full mouth extraction on May the 3rd and currently has upper respiratory infection and is on doxycycline. He also has megacolon and takes lactulose with these medications. Would it still be okay to give it before and after if he has a full mouth extraction? And this is also a really important part to that question. They stated that since I'm driving so far, they would do him first in the morning and send him home after later in the evening. The question is, would that be okay, or should I request to stay overnight, as they may be sending home with pain and medication also?
Okay. Well, the first thing is, as I mentioned earlier about the anesthesia portion, you want to do the full physical exam and workup. If this cat has a respiratory condition, you may want to have an x-ray of the lungs, because, if it has pneumonia, you don't want to put it under anesthetic. You want to get that respiratory infection under control first, because otherwise that's a sure sign that you're going to be having trouble. Okay, so the second question about having it on doxycycline and was it lactulose for the megacolon? Is that right?
Yes, that's correct.
Then to give it right after would be fine. Actually, doxycycline is actually a great product for periodontal disease and stomatitis, because it's not just an antibacterial, especially to the pathogenic types of bacteria that are in the mouth, but also, and more importantly with doxycycline, is it's an anti-collagenase. What that means is it prevents collagen from being destroyed from periodontal disease. And as a result, the gums will be stronger and healthier. Collagen is the first tissue to be destroyed in gum disease. So having that on board is going to be very helpful for the mouth. The other question was, about staying overnight. Well, what I try to do with clients is let them know that there's a chance that they may stay overnight, but we like to get them home as soon as possible, because the animal is more comfortable at home than in the hospital. In the hospital, they're stressed. Even though we try our very best to make it minimal and try to make it as comfortable as possible, you're not going to get the same stress-free environment as a home. It's just like yourself. You're in the hospital. The last thing you want to do is stay in the hospital. You want to get home as soon as you can. Sure. And the same with pets. So unless the animal really needs to stay, and the veterinarian should be able to tell you that after the procedure, and I hate to say it, but most times when I've had full mouth extractions or partial mouth extractions are the times that we need to keep them overnight. But usually it's only about maybe 4 cases a year for me, and we're doing hundreds of cases every month. And so it's very few and far between, because I like to get them home as soon as possible, but also I want to make sure that the caregivers that are giving the medications and other supportive care are able to do that at home. Because if you're not able to do that at home, then they should stay in the hospital until the cat can easily go home, and you can then, or the caretaker can, administer home care products and that.
Excellent. Thank you, Dr. Anthony, for that answer. Let's go into the next question. If you just joined us, you're live with Dr. James Anthony, boarded veterinary dentist. The next question is, how can I tell by examining my dog, in this case, cat, or if my dog or cat's daily oral health hygiene program is adequate. How can I measure or determine that?
Well, you could be very simple or very advanced as far as the procedures that you could do to see if that works. The simplest one, which I would say that everybody could do and is basically cheap and easy, is get a little tiny piece of toilet paper, put it on your finger, lift up the lip, gently wipe the teeth, and look at the toilet paper and see if there's any yellow discoloration or any type of brownish or blood or anything like that. If there is, it means that you're not doing a great job with hygiene. Yes, that's taking away, that's wiping off the plaque. Plaque needs to be taken off daily, and if it's not taken off, that's what will lead to inflammation and then the destruction of the tissues.
Got it. So quick procedures. What about bad breath? Is that also a quick way to determine for my cat or for my dog?
Well, if the cat or dog ate a piece of garlic, that might give it bad breath, but that doesn't mean it's bad health. But I know what you're talking about. But the pathogenic bacteria produce sulfides, and basically that's the smell of gas, flatulence, and that's what gives it the bad smell. It's the sulfur that's there,
Right.
and it's a sign that there may be some problems, but some people that smell can be from the stomach as well.
Right.
And so the mouth may be healthy and the stomach is, having an upset problem.
Excellent. Thank you, Dr. Anthony, for that. Let's go to the next question. My cat has been on low dose of dexamethasone, 0.1 per milliliter, twice a day for 3 years. He may be having a partial mouth extraction soon. Should he be weaned off before the surgery? I have weaned him off for about 30%, but then the inflammation really flared up. What should this person do or consider?
Well, I've already mentioned about my feeling on steroids, so
Right.
I don't want to repeat that. But what they should do in this case is try to wean them off as much as possible, and using some other host modulation products, such as 1-TDC to reduce inflammation. There could be other products available. NSAIDs are another one. You don't want to use those long term, but short term are fine. And as a result, there are other things that one can use to wean them off that and make it safer for the anesthetic. I would always recommend that they try to wean them off the steroids, because basically the steroids basically they suppress the immune system. And usually with stomatitis, we are dealing with a hyperactive immune system, but sometimes it can be basically a depressed immune system as well. And as a result, if you did a procedure and it's depressed, you could actually make things worse. So as a result, I would always try to wean them off if all possible. And sometimes you can't, and it's the risk you take.
And maybe one thing, because I've heard you say that clinically so many times, in the case of the 1-TDC to help promote healthy inflammatory responses, your dosage is different for those cases, those stomatitis or those stomach cases. Could you please clarify that? Because some folks might already be or considering using the product. What's the right dosage?
Well, the dosage on the bottle is 1 gel cap per day per cat. What I do with stomatitis is actually do 2, one in the morning and one at night. And do that for a month, and then I go to once a day.
And keep them on one a day, I think you said, yeah.
There's no side effects to it, so it's not going to harm the animal in any way.
Yeah, definitely should be a go-to. All right, let's go into the next question. Other solutions that are out there as well. Is Proton Plaque Off safe for cats? We hear that a lot for dogs. What's your thought on cats?
Well, it's safe for cats. It's an iodine-based compound from kelp, and basically, so it's really an organic product, and it is safe. It's just that cats sometimes do not like the taste of it, and you sprinkle it on the food, and they smell it, They taste it and they say, "No way, I'm not having any part of this. Take it away." So
Understood. At least it's safe. I think that's initially the question. Right. Thank you, Dr. Anthony. Uh, Next question for Dr. Anthony. Cat still in pain after a full mouth or partial mouth extraction, but with no extras taken before and after. What steps should be taken? Any way to determine the problem without putting the cat under full anesthesia?
Well, definitely full mouth x-rays are warranted because of retained roots also inflame bone. Okay. Basically, you need to take the x-rays. And in order to do the x-rays, unfortunately, dental x-rays need to have the animal anesthetized. Otherwise, basically, it's impossible to get x-rays. You can't tell the cat to open its mouth and hold it still for, 5 seconds.
That's not going to happen.
That's just not going to happen, as you said. So, yes, they do need to be anesthetized, but dental x-rays can be taken very quickly. You can have full mouth x-rays taken in about 15 minutes. So it's something that, or faster. So it's something that can be done fairly efficiently and is imperative for your treatment planning to basically do that so you can see exactly what you're dealing with. Because 9 times out of 10, it'll be a retained root or inflamed bone that's still causing the problem.
Yeah, thank you for that. If you've just joined us, we are live with Dr. James Anthony, boarded veterinary dentist, over 30 years of clinical experience as a boarded dentist, answering some submitted questions. If you join and you have a question, or if you've been watching and you have a question that come up that hasn't been asked that you would like answered, we'll be happy to cover that as best as we possibly can. And if you've missed the early part of the show, just put stomatitis in the comments and we'll go ahead and get you access to the full recording. All right, let's go to the next question. And this is something that's often asked is, when do you recommend a partial mouth extraction versus a full? What are your determinant factor in really educating the pet owners that are often wrestling with that decision?
Well, the first thing I would always do is talk about even home care and see what the owners can do for home care or what they're willing to try. Because for me, I'd rather not take out teeth. I'd rather save them. I'm in the business of trying to save teeth, not pull them out. So for me to pull a tooth, there's got to be very good reasons. But again, if an owner can't do any home care or say, no, that's not going to happen, then I may end up doing partial mouth extractions. When I say partial mouth extractions, usually what that means is taking all the teeth out except the canine teeth. And the canine teeth are important to leave because those are their defense weapons, but also it would give basically stability to the alveolar bone, the bone in the jaw. Without those teeth, the bone is going to be slowly reabsorbed, and as a result, could make the jaw much more fragile and easy to fracture, that type of thing. So I prefer to try to leave some teeth in just to retain that bone. But also, for me, I try not to even have extractions if at all possible. However, most times there's going to be some extractions necessary. I hate to say that, but that's the reality of it. But if we can try to do home care, we can save those canines quite easily. And the canines are the most important teeth to keep.
Is there maybe an extension to that question? Is there any cases where you've opted to go straight to a full mouth extraction versus a partial?
The only time I'll go for a full mouth extraction is if the canines themselves are affected and they're severely mobile or have very deep periodontal pockets or abscessed or broken. They have an endodontic disease where the pulp is exposed. Those cases I would take out.
Okay, now good. Thank you for answering that, because a lot of people have that question. The next question, and this really to help a lot of folks in our stomatitis group that often, are trying to wrestle with the diagnosis. So sometimes the lack of the diagnosis that they're getting. So here's one. The vet said it's a mild case of stomatitis. Is there such a thing?
Well, I don't consider stomatitis mild. Basically, stomatitis is basically severe inflammation, and that is painful. Simple as that. So there's no such thing in my mind that there is a mild case of stomatitis. Rather than mild, I would say early stomatitis. So before it becomes super ulcerative, where basically we have severe ulcers in that, where it's really important then to get painkillers into them, just for being humane. So as far as it being a mild case of stomatitis, I don't consider that a real diagnosis. It's either stomatitis or it's not. And again, you can't really tell it's stomatitis until you do a histological diagnosis. Because it could be just advanced periodontal disease. And especially if it's just one side or one quadrant of the mouth that's inflamed, 9 times out of 10, that's going to be periodontal disease. It's not going to be stomatitis, but you can't have a stomatitis associated with that area, a localized stomatitis.
And from the steps that you take based on what you've shared in this live, you would take the same approach from a home care perspective if it's
Correct.
mild, severe? Okay.
Yes.
And for those of you that have missed that, Dr. Anthony covered that a couple times on this live. And please put stomatitis in the notes, and we'll get you full access to this recording. Next question. This is also something that comes up a lot. A lot of patient owners sharing with each other talk about Zartec, or also known as the ingredient of Zarek. What can they expect of that product realistically for the cat? Now, obviously, I'm going to venture to say it's not the cure for stomatitis, but what should they use it, and what should they expect?
Well, the first thing you should realize is Zyrtec is just basically an antihistamine. That's really all what it is. It's an antihistamine that decreases basically the excess of mucus in the mouth. So people get the false perception that it's getting better because there's less drooling, while it's just being an antihistamine. It doesn't really affect the ulcers or anything like that. It doesn't affect the bacteria. That could be even worse, because by drying it out, you have basically bacteria covered by a little cake of material, so it's protected in a sense. It also will make the cat a little bit quieter, and as a result, people think that, oh, it's not feeling as much pain because it's not pawing at its mouth all the time. Well, it's because it's sleepy. Simple as that. It's just not, it's just not feeling it's just not reacting to the discomfort as it would. Does he have the same discomfort? Absolutely. It's just that it's basically he's too sleepy to do anything about it. So is it wrong to give it? The answer is no. But really, it's not really doing very much, to be honest.
Okay. From a treatment standpoint, it's a temporary, aesthetic. We just had some other general questions, actually, that you get a lot question asked. So I'm going to give you a couple of quick ones as we wrap up here. And if anyone has any other questions, please don't hesitate to put it into the notes. And specifically, lactoferrin. What is it, and how can it help treat stomatitis?
Well, lactoferrin is a product where it actually is it's actually in milk, and it's an anti-inflammatory, and we use it for host modulation. It does have some benefit in the mouth, but there's other products that are far more effective and far cheaper.
Okay.
So does it work? Yes, but moderately.
Excellent. A general question as well is, is stomatitis contagious?
Some of the predisposing factors of stomatitis, such as calicivirus, herpes virus, feline immunodeficiency virus, feline leukemia virus, are contagious. However, those products or those viruses just by themselves don't all cause stomatitis, using its a hyperactive immune system to the virus and the plaque that causes the condition. So it basically is it contagious? Stomatitis technically is not contagious, but the viruses that can act as a predisposition for it are contagious.
Excellent. Yeah, thank you for that answer. We have another question actually from Hootie Clark, and let me just pass that on. What would you say about lysine in stomatitis?
Well, L-lysine is a protein, and actually what it does do is it does have a very mild anti-inflammatory effect and would be okay to use. Again, is there other products that can be better? The answer is yes, but it's not for every single cat. But it's not wrong to use it. Have I used it? The answer is yes, but not as much as a lot of other products.
Is it a good idea on that note? Because I know you've clinically used so many of the one TDC product with your cases. Is it a good idea to combine those two, as an example?
There hasn't been a study to show that there's a good or pro or negative effect of that. So I can't really say. I can't honestly say that. I'm not sure. Sorry.
Yeah, that's the scientific man for you. Will not pronounce unless there's valid research behind it, and we appreciate that. Maybe a last couple of questions for you, and this is kind of a sensitive one, but I think it's important, and I think probably in a lot of people's mind. How long can a cat or cats live with stomatitis?
With treatment or without treatment is probably the best question. And
I think you might want to answer both.
Without treatment, basically, an animal can live, but the quality of life is poor. Okay? I always view life as a thing of quality of life. And if the animal's quality of life is pure hell, really, what are we doing for that animal? But with stomatitis, people ask, can you cure it? I'll be very honest with them and say, no, we can't cure it, but we can control it. So what I'm saying here is with some mild, minor home care, we can keep it in check and prevent it from being flared up. However, stressful situations, poor diet, good health starts with proper nutrition. So poor diet, stress will have an exacerbation of the stomatitis. But it can be kept in check quite simply with some very minor things. Each animal is slightly different, so it has to be customized to meet the patient's need and also the client's need, meaning, can they afford it? Can they do the home care on the minor stuff? All those things have to be taken into consideration when you're doing this.
No, thank you for that. And as we wrap up, you talked about nutrition. Is there any type of role or recommendation that you have around nutrition in managing stomatitis? Anything they should stay away from? Ideally, see a nutritionist, but is there anything they should stay away from or that you would highly recommend from a nutrition standpoint? Well,
as far as nutrition, getting a full balanced diet is the key. A full balanced diet is crucial. I like getting a dental diet as a treat. I mean, some of the dental diets are not the best diets around, to be honest. However, they're really good for keeping plaque and calculus under control in the mouth. And as a result, using it as a treat can be very, very effective in keeping the mouth healthy and also giving a little bit more nutrition to the cat. But again, to use it as a regular diet, hey, there's a saying, if it ain't broke, don't fix it. So in other words, if you've got a good, healthy, balanced diet, keep with it, and maybe just add a few of the dental diet kibbles as a treat. Maybe 10 a day. Simple as that. So that's how I would approach it. So to say, well, this diet is better than other, it's hard to say. You have to look at the animal's condition, Some cats that have a tendency for renal stones or something like that, or bladder stones, may need a special diet. So if the animals need a special diet, you have to be a little bit more, have more consideration as far as what you can or cannot give.
Got it. And I think in Riel Pagan, who just put a note in, is asking, is there any specific dental diet that you have used and could recommend?
Well, there's three that I really like personally. They're all approved by the Veterinary Oral Health Council. One is Hill's TD is one, then Purina Dental Diet, and Medi-Cal Dental Health Diet. All three of those are excellent diets as far as for prevention of dental disease, for plaque and calculus control. And again, do I recommend using it as the regular diet? No, I recommend it as a treat. But I'll be honest with you, with my dogs, I just have had them on the dental diet ever since they're an adult dog, and I haven't had to do any brushing, nothing. I give them TDC, but that's about it. TDC and the dental diet, and that's it. And I've never had to do any work on my dogs.
Right. And just to be, yeah, it's right. It's to be specific. That's not a patient with cups in this case for dogs, or a cat with stomatitis. That's a prevention aspect of it.
Yes.
Yeah. Excellent. Well, thank you, Dr. Anthony. We really appreciate all your life experience in helping animals and your expertise in dentistry. If you've joined us now, we're timing out, but if you want to get a full copy of the transcript, just put stomatitis in the notes, and we'll get that to you. And Dr. Anthony, we thank you for your dedication. I know that you're a very busy man, and we were very thankful for all of the participants' questions submitted prior and during the show. And we look forward to see you in the future. And hopefully this was very helpful for all of you who are dealing with tough situations with your cats.
Well, it's a condition that's very painful for these animals. And with treatment, they can really have a tremendously improved quality of life. So that's the main criteria of doing this. And thank you for inviting me. It has been a pleasure.